Well, there is fantastic news today in the fight against one of the world's most deadly diseases. Joining us now is Africa 54 health correspondent Linord Moudou to tell us more about it. Linord.
The World Health Organization has announced an end to the Ebola virus outbreak in Liberia, meaning all three countries at the epicenter of the West Africa outbreak are now considered Ebola-free. The WHO announcement Thursday came after 42 days without a new reported case in Liberia. When announcing the milestone, the WHO cautioned that more small outbreaks are expected and called for continued strong surveillance to keep the disease at bay. The organization's representative in Liberia pledged that the WHO will continue to support Liberia in its effort to prevent, detect, and respond to any new Ebola cases. This is the first time all three countries at the epicenter of the outbreak, Liberia, Guinea, and Sierra Leone, have been Ebola-free at the same time. Sierra Leone was declared Ebola-free on November 7th and Guinea on December 29th. The Ebola epidemic in West Africa killed more than 11,000 people in the past 2 years and infected over 28,000 others. U.S. President Barack Obama on Tuesday delivered his 7th and last State of the Union address. While he elaborated extensively on domestic matters, he also addressed global issues. The president spoke about the importance of United States aid to African countries to address health challenges such as Ebola and malaria.
That's how we stop the spread of Ebola in West Africa. Our military, our doctors, our development workers, they were heroic. They set up the platform that then allowed other countries to join in behind us and stamp out that epidemic. When we help African countries feed their people and care for the sick, it's the right thing to do, and it prevents the next pandemic from reaching our shores. You know, right now we're on track to end the scourge of HIV/AIDS. That's within our grasp. And we have the chance to accomplish the same thing with malaria, something I'll be pushing this Congress to fund this year.
Joining me in the studio for more perspective on President Obama's health-related remarks is VOA reporter Carol Pearson. Carol, welcome to Africa 54.
Thank you, Lenore.
First of all, West Africa is Ebola-free.
Wonderful news.
Isn't it good news?
Yes, and you know, I've been talking to experts. They've been talking about lessons learned. Number one is that all countries have to have some sort of better health systems where they have laboratories, where they can diagnose things, where they have treatment. Now, this brand of Ebola, the type of Ebola, Zaire Ebola, was believed to be 90% fatal. However, they learned in this epidemic that if you treat people, if you give them fluids, you can reduce that to make it like 20 to 30% fatal. So you can save a lot of people's lives. And then the other thing, the goal now is to make sure that hospitals have running water, that hospitals in these three countries have electricity, that they have trained staff, that they have disease detectives, people who can go around and trace contacts. That's why Ebola was stopped in Nigeria when it went over there, because they had these things in place.
And also, it took collaborative efforts by the global community, including the United States, that played a role there, as President Barack Obama mentioned.
Yes, the U.S. military, they went there and built treatment units. Doctors from the CDC, the Centers for Disease Control, the National Institutes of Health worked on treatments and on vaccines. They trained people when they were there. It wasn't just them coming in. The goal was to train their own health workers, and that's what finally succeeded in getting Ebola, plus the vaccine. Vaccine in July was found to be 100% effective. And if you vaccinate all the contacts of somebody who has Ebola and vaccinate their contacts, you can stop the disease.
Quickly, what does this mean now that West Africa is Ebola-free? What does this mean for the vaccine in the future?
They have a vaccine. Merck, a pharmaceutical company, I believe it's called MBR, outside of the United States, they have made the vaccine. They are storing it. They're going to have enough in place so that wherever this strain of Ebola breaks out again, they will have the supplies. They're also working on using a vaccine or developing vaccines against the other strains of Ebola, against Marburg and Lassa fever too, other hemorrhagic fevers.
Okay, and during the State of the Union address, President Obama also spoke about cancer. He talked about the stepping up efforts here in the United States to fight cancer. First of all, let's take a listen and we'll continue talking about it.
You know, last year, Vice President Biden said that with a new moonshot, America can cure cancer. Last month, he worked with this Congress to give scientists at the National Institutes of Health the strongest resources that they've had in over a decade. So tonight I'm announcing a new national effort to get it done. And because he's gone to the mat for all of us on so many issues over the past 40 years, I'm putting Joe in charge of mission control. For the loved ones we've all lost, for the families that we can still save, let's make America the country that cures cancer once and for all. What do you say, Joe?
Now, President Obama said a new national effort. What does this mean when we know that America is really one of the countries in the world that is leading the way in terms of cancer control and prevention?
Yes, but you know, the countries that suffer the most from cancer are developing countries. So if the United States can lead the way, what they're hoping to do is that they can control various kinds of cancer. It's not just one disease, various diseases, and it requires different approaches for each of these diseases. So if you can control cancer, then these advances will hopefully help people in developing countries as well. The president is going to submit his budget next month, and with this, he wants to submit a sizable increase for the National Cancer Institute, which is part of the National Institutes of Health, for research and development.
So more funding in the loop.
Yes.
More funding. So quickly then, moving forward in terms of cancer control in Africa, what did experts tell you in terms of the priorities, quickly?
Well, there are different kinds of cancers we already can control too. We have vaccines against HPV, so we can prevent oral and cervical cancer with a shot, or a series of 3 shots. So that's wonderful news. We know that we can prevent cancer of the liver by vaccinating against hepatitis B. Now, we've also made a lot of progress in treating breast cancer, and that's one of the #1 killers of women around the world. And if that's multiple types of diseases too, there's not just one type of breast cancer. So we need research on all of these areas.
Okay, so some encouraging news, and we'll be keeping an eye on it. Thank you so much, Carol, for joining us. And that was VOA's Carol Pearson reporting. That's our Africa Health Report for today, Vincent.
Well, thank you very much, Linord. Be sure to watch Linord Moudou's health reports every Tuesday and Thursday right here on Africa 54.